Otherwise, the CS, the bills are quite okay. We just need to have a team sit down in the spirit that we had agreed upon in Naivasha, and we will be able to rush through, and then this team still receives the views from the public, so that we ensure that whatever that has been fed into the bill is what has been agreed upon by the two levels of government. Otherwise, the spirit is okay, and we will be willing to participate in this so that we have an agreement from onset. Thanks, I over to you, Chair.
Thank you, Chair. You know, I normally watch the news when they have already passed by several hours. If that would not be the case, yesterday night I would have called the PS Harry Kimtai, because I was watching news almost at midnight. And I saw Harry say that we have already consulted the COG and that we'll still have a further conversation with them tomorrow. I almost called you, but I said, let me wait for today. Then the other day, I also saw you, PS Harry. You issued a very contentious statement that can light fire in public. You said that one of the reasons why we have FIF and we want to be a bill is that most of the money that is generated from our facilities does not there find its way back to the facilities. It may have been the reporting, but when that statement is left hanging there, the public is left to question themselves, where does that money end up if it does not end up to the facilities? You know, those are some of the things we want to discuss, otherwise it can blow up in our faces and become almost unimplementable. It is important to have a communication that communicates. We say it's not just communication, but effective communication. That is what we are looking for. With that, I would take this opportunity to invite our chair of the Council of Governors, Governor of Kirinyaga County, Governor Anoigoro. Just to greet us, you'll still close, just to greet us and say that we are here, we are doing a good job, or we are letting you down. Just greetings, Chair, with all due respect. Don't make your closing remarks. Tupigie Chair makofi.
It's okay, don't move. The CS for Health, my sister, Honorable Susan Makumicha, PS Health, Excellency colleagues who are all here, led by the Chair of the Health Committee, Governor Muthomi Njuki, CEO of COG, all partners present, good morning. Good morning again. I'll start by apologizing for coming in late. Usually the chair doesn't attend committee meetings, and I had scheduled other engagements which are running back to back, but I decided to just step in solidarity with the entire team, because we agreed these issues are critical to the entire 47 counties, and therefore we should try as much as possible to participate in all of them. I really don't have much to say. I'm glad Governor Muthomi has clarified that I wasn't closing the meeting. I was about to close it because I walked in and I was hearing the already proposals on the recommendations of a technical team, and therefore I wasn't very clear then therefore what we'll be doing if we're going to be handing over to the technical team. But I agree, as been advised. The only thing I would want to maybe mention is that this process of these bills has been here for a while. We have been back and forthing on various policies and legislation that are required for the UHC. We have participated at certain levels, but we feel that we should participate before their bills are finalized to go to the National Assembly. I have had a small briefing on the various bills by the team that we have from the COG, and from my view, there are some pertinent issues that we need to look at, but I wouldn't say that they are deal breakers. There are issues that does need to be clarified and just put in the bill. One of the issues, for example, on the data that is going to be managed in the ministry, As the ministry sets a policy, for example, we had discussed in Naivasha about a superhighway, and all counties will be linking into this superhighway, and the data will be being minted by the national government from the superhighway. I think up to that level we are okay and we are in agreement, and ensuring that all our health management systems feed into the superhighway, that they are able to be integrated and the data to go in. The only concern that we have is that once the data is consolidated, the regulations that guide the access of that data by the counties is what would be of major concern for us. If you say that the ministry will be the custodian and the counties would have to seek the permission of the ministry to access data that corresponds to or relates to a specific county, that can be of great challenge to us. So we need to find a way where counties' consolidated and analyzed data is provided on real time in our databases as well as in the national, and that requirement of seeking the permission from the national government may be to be waived. And I will explain why this is so. If, for example, I hear that we have a malaria outbreak in Kirinyaga or Bilharzia because we grow rice and we have challenges that have to do with the snails, the red apple snails, etc., I may want to make a very quick decision about an intervention. And for me to be able to get the data, I would not want to be hindered to have to write to the ministry, for the ministry to give me the data on malaria prevalence in Kirinyaga, for me then to be able to take the decision in that regard. So that's just to give you an example, and that applies for maternal health. It will apply for all other disease burdens that we have in the counties. The second issue that I think has been raised and is of concern to us again is on the issue of the FIF. As you have heard, most of the counties have now passed the FIF. I know the FIF for Kirinyaga is actually on my desk. We've backed and forth on it at cabinet for about 4 times, and it should probably be passed next week. There are certain unique things that we include in our FIFs at the county level that are not necessarily included in the national level. I'll give you an example. When we are licensing restaurants and they need inspections by public health, there is revenue that is collected in that regard, and other public places, and that cannot be overly prescribed at the national level, including the rates, because those are county-to-county determinations provided by the Constitution and the finance law, that the county is the one that determines how much they levy on various services that they provide. So what I would suggest is that on your legislation, make it broad and a policy-based law that gives the room to the counties to be able to specify certain levies and fees that they may want to charge in public health related fees, so that they can also determine for themselves according to the Constitution and the law. Again, the other one has been raised by Chair Health is on the the community health workers and how we manage that. We had agreed in Naivasha that the national government will forward the money to the counties, and then the counties will pay. But now the requirement, the new introduction, that these community health workers need to go through the approval of the county public service boards complicates matters, because if you look at the law that governs the county public service boards, you will realize that they deal with permanent employees, and once you put them in that system, we will be obligated to have them recruited, and then there are other attendant costs that come, NHIF, now the new NHIF, let me call it that, and NSSF and the taxes, and then there will also be issues of unions and all that. So again, another proposal, please be very considerate of that issue. These are community health volunteers. They are not employees. We now call them promoters because we are giving them a little bit more responsibilities and also to motivate them, but not necessarily to increase our wage bill. And you know very well, Waziri, we are under strict restrictions of how much we can spend in our recurrent expenditure and on our wage bill as a proportion of the overall resources that we get from the national government. I think that's just to mention a few, and also to just let you know that we at the county level, we have been having deliberations on these bills from bird's eye view. But I agree completely that we need our technical teams to look into it, to sit and ensure that the issues of overprescription are not in law, and we give the room and the leeway to the counties to conduct most of these functions in accordance to the Constitution and the law. I think I will leave it at that, and wish us all happy deliberations. And once again, as you can see, I've done my homework. Even if I've come late, I didn't come completely not knowing what it is that I need to do. But we've been keeping abreast with what is going on with the Ministry of Health, and we're looking forward to finalizing these bills in the soonest time possible. We will be working with our Secretariat and Mary to ensure that we do not in any way become a hindrance to the implementation of the UHC. We're all aware that the President will be launching the UHC on 20th of October, and all of us in our counties will be launching UHCs, and these bills, even if they come after the official launch, are critical to ensuring that we succeed in the UHC. Thank you and happy deliberations.
Another louder applause to our chair. Ever on point, very informed. So yes, the mood in this room is that there is more work to be done by our technical committees before we give this to the managers of the counties. So I'll give you this opportunity to tell us your view, because that is what has been endorsed by our teams. So I'll give this opportunity now. I'll give the microphone back to CS, our very hard-working CS, to come and give us a way forward. Tumukaribisha na makofi.
Thank you very much, Chair Modomi, for taking us through that session, and thank you, Chair COG, for the inputs, and to thank all the Excellency Governors for the inputs that they have given. Allow me to make a few clarifications, then agree on how we move forward. One, I would like to clarify, Your Excellency Governors, that what we are providing in these bills is a policy framework, which is the role of the national government. And as Chair COG has said, we make it as broad as possible. Matters of implementing whatever is going to be in the bill, we will go to the second level, which is regulations. Regulations are the one that then prescribe the manner in which the bills will be implemented. So we have a long way to go. This is a policy framework that we are providing. But I'm happy that you have already taken time to go through the bills and give us the reviews that you have given us, which I believe they have come at the right time in terms of improving the bills before the enactment by Parliament. The second clarification that I would like to make, Excellency Governors, is that these bills have not been developed from nowhere. They have been developed from existing documentations, and the existing documentations have been worked on together with COG. So believe me, that your voices are already in these bills, but agree that we should have more time for consultation. For example, we have the guidelines for strengthening the mobilization and utilization of funds in public health facility that was done in 2022. And that was done with the input of COG. We also have the primary healthcare network guidelines 2021 that was done with the input from COG. We have the model law also with input from COG. So your voices are already in this, that we have actually picked our foundations from those critical documents that you already played a role in developing them. So we'll move forward with the engagement so that then we go to this broad-based. The other thing that I would like to highlight and also congratulate the governors that the bills have elicited the kind of discussions that we are looking forward to and that you have taken your time to read through. I read that there are varied interpretations already in the room. For example, on CHPs, even at the national level, we agreed that they are not workers. And that is the reason why we did not call them community health workers, because it was the easier way to call them and not volunteers. That's how we settled on promoters. So the issues in terms of them being part of the wage bill, that we are cognizant of it, and that is an amendment that has to be done if at all it actually appears in our bills. It ought not to be there. They are not employees. They don't need to be part of the wage bill. And so the issue of them going through the public service boards, that has to be revised. I hope, Terry, you are taking notes. Then also the issue of FIF. And true, we had a discussion in Naivasha. But maybe just to remind ourselves is that we agreed that within 2 months, the remaining counties will have passed their FIF bills, and that if it was not going to be possible, then we create the national framework. But having just discussed with the chair and the Governor Muthoni there, that it doesn't harm anything for us to have the national framework, policy framework on the FIF. It doesn't harm. Then you can have the individual county descriptive frameworks in terms of what, but we'll provide the big one, the broad-based one, that then those can borrow into. But in terms of implementation, where we have to have your minds and critically looking into it is in the regulations that will operationalize the FIF. That is where all the information needs to be. On the primary care networks, if you have had a chance to look at the details of the bill, the bulk and the majority of the work is actually being done by the county governments. Even the establishment, that as we are our role is to do the gazettement after the work has been done by the county governors, and that is what we are providing for within the bill. On the data, I hear the issues that have been raised, but let me respond to especially the access. And my director, Dr. Langat, is here, he'll correct me if I'm wrong. That we shall provide in the regulations levels of access. So that if Governor Muthoni, you need access to the data of Tharaka Nithi, then you have it. But you have no access to the data of Kirinyaga County. And if Kirinyaga wants its own, they have access. We shall provide for those levels of access in the regulations that shall be established. So it should not be a big issue. But at the national, we'll have access to all the data because we need this for planning, and planning specifically for resources and many other things that we need to plan for. So having listened to that, I think we were very excited to highlight for you for what is in the bill. And maybe we may not then go into the details of highlighting because now we will have a technical team to look into it, one from COG and our team from MOH, and it is a working team. It is ongoing. I believe that that engagement was already part of our schedule in terms of the people that we were supposed to engage in. So it is part of our schedule. Actually, when was it supposed to be? The engagement? It was actually supposed to be, sorry? Next week. But now we are going to fast track, bring it forward, so that then it happens earlier. And whatever issues that come from it, I want to agree with I think it was Governor Sang, who said that then we make a memorandum and make it part of the presentation. Because even Parliament is not moving yet, because these engagements have to be finalized. But it is important that they also get to start having a feel of the bills and also start getting information. But by the time they begin their public participation, we shall have already prepared what we need to do in terms of input to them. So with those remarks, I want to thank you and believe that we are okay. We are in a good space. We are agreeing that the technical team will sit and provide all the information that is required, but happy that the spirit is that this is the direction we ought to move on matters healthcare. If you are telling me that now we do away with these bills, that would worry me. But listening to all of you, you are in agreement with us that we proceed this way, but we provide for some time for the technical teams to sit and add value to the bills, which is a good thing. So thank you very much. Okay, so now that is on the bills. Now we move to I believe we're in agreement that the technical team sit, and they will not sit next week, but it will be brought forward because we have critical timelines to meet from tomorrow. So you have to split yourself in teams. Even if today, I don't mind. PS has said that he will sort that out. Thank you very much. So we move to the other level of my presentation, which was the preparedness for Mashujaa Day. Where's the... So, Your Excellencies, as they continue to connect, as I said in my introductory remarks, the Mashujaa Day celebrations this year, the theme will be universal health coverage. So our intention is to showcase to the entire country and of course the whole world the efforts that we are making towards attaining UHC. We also want to sensitize the population on the efforts made by the government and partners towards attainment of UHC. We also want to showcase the role of the various partners in health, including investment and innovations with a focus on the public and private sector development and implementing partners and the civil society. And we also want to increase awareness of the population on their entitlements to the social health insurance and increase insurance coverage of population. The pillars of UHC, I believe they are now known to all of us: the health commodity security, health financing, digitization, and human resources. So the celebration will focus on the 4 pillars. The proposed theme is leaving no one behind in accelerating universal health coverage in Kenya. We want to have a whole of society, a whole of government approach, and inclusivity. Location is in Kericho County. The governor was here. I think he has stepped out because of preparations. And there is a slogan there to mean human is the greatest resource that we have. Healthy citizens are the greatest asset in any country that we can have. So our plan is to have a week-long activities starting on the 13th of October to run into the final event on the 20th of October. So the proposed activities on each of those days: on the 13th, we shall be showcasing a smart PCN, one that has already been digitally operationalized in Bureti sub-county. We shall also be showcasing local manufacturing. The expo will be ongoing. The manufacturers will have their booths and have places to present whatever it is that they are manufacturing. And we'll have a national dialogue on health, a plenary discussion chaired by His Excellency the President. On the 14th, which is the following day, we shall be focusing on digital health innovations, and all partners, all private sector, and anyone else who is in the digital space of healthcare shall be showcasing on that day, and the chief guest will be the Prime Cabinet Secretary. On the 15th, which is a Sunday, we shall have a healthcare leaders breakfast meeting with His Excellency the President, and thereafter we do interdenominational prayers led by His Excellency the President. On the 16th, which is Monday, we shall have health innovations. Booths shall be there, and people shall be showcasing the innovations that they have done in health. And we shall also be proceeding with a discussion on local manufacturing. And the guest of honors will be Honorable Eliud Owalo, who is the Cabinet Secretary for ICT, and Moses Kuria, the Cabinet Secretary for Trade. On the 17th, we intend to have a dialogue on human resources for health, and that dialogue will be led by the Honorable Florence Bore, who is the Cabinet Secretary in charge of Labour and Social Protection, and they'll be doing it together with the Cabinet Secretary Aisha Jumwa, who is the one in charge of public service. On the 18th, we shall continue with the discussion on human resource for health. By the way, Excellency Governors, this one for HRH has attracted the most in terms of discussions. So the discussion there will be led by Head of Public Service, Felix. Then the 19th, we shall have a health walk challenge in the morning, then an expo on health financing, HRH, like a whole, the 4 pillars together, and the chief guest will be His Excellency, the Deputy President. Then on 20th will be then the real day for the celebrations, which is Mashujaa Day, and our main function there will be to parade our CHPs from the various counties and the health workers in general. In many occasions, governors, you're always asking of us as a ministry. Now, today we have some asks of you. That one, that you nominate governors to co-chair each of the 7-day activities together with the guests that have been identified. I believe the Chair of Health will take this up and will give us names. Then also that nominate officers to join the organizing committee that is already ongoing on behalf of COG, that we have officers to join and participate. Then we are also asking of counties that they nominate 100 community health promoters per county to join in the presidential parade on the 20th October at the Kericho Stadium for the Mashujaa Day celebrations. The logistics will be taken care of by the national government. So all you need to do is nominate and give the lists to us. I think that is our plan for Mashujaa Day. I don't know if there are questions that I need to respond to. I heard you, Chair, on the issue of HRH, but I believe the next slide has somehow responded to it, that we need people to participate in each of the pillars, so that then we can listen. I know the one for HRH is... Yes, Chair.
Thank you, Waziri. That to clarify, just to check, from my understanding, every county is also supposed to, with their own Mashujaa Day, decided by the governor to do the same, something similar.
Yes.
So that we launch on the 20th.
Yes.
They do it in every county, simultaneously, isn't it? Okay, so then we will need to work together, because that means there is no governor in Kericho other than the host governor. If we are all launching in our counties, maybe you need to think through that. Maybe pick regionally, I don't know. If you want governors to be with you, but if the governors are expected to do the same in their counties, then maybe you will just need to prioritize how many you will need of the governors to be in Kericho. Just that.
Okay.
Yes, a good presentation. Mine is just to propose that that is a very heavy activity that can overwhelm one county. Yet we have neighboring counties that can actually be able to co-share that function, so that if it is possible to spread them across just the area around Kericho, we have neighbors and Bomet, we have others like Wasingisho and so on and so forth, so that the impact will be spread. We have better results.
Thank you. Okay, so I believe my team has taken those comments. Yeah. Thank you. So in the absence of any other information, I think then that brings us to the end of this meeting, to allow then the technical officers to retreat and do what we have asked of them. Time is of essence. The Parliament shall be publishing the bills for first reading on Thursday next week. So you have to finalize your work latest by Tuesday. Thank you very much.